Nice. Great question. Yeah, so uh, this tends to be case dependent, right? So what I do is I look at each veteran or patient, right, and I determine it based on that. So there's a lot of factors, right? So now let's say that someone has PTSD, right, from very significant stressors, and this PTSD has been around for a number of years, right? And they have been on multiple medications without without significant benefit, right? Maybe there's been some benefit, but it's not significant enough for them to achieve remission, right? What we call remission, which is uh, resolution of symptoms. You have relief. Okay, so um, with that history, and then talking with the patient over time, we're talking with the veteran over time, that's when I determine, okay, this condition, it has been here for many years. We've tried a number of different medications. These medications are somewhat beneficial, but not really. And we keep looking for other options and alternative strategies. The veteran goes to therapy regularly, and the condition is the same. I would rule that as static, right? Barring anything really different happening somehow, some drastic change in the mental illness, right? Which is unlikely. Now, let's say someone has an adjustment disorder or maybe even a PTSD, but the trajectory has been going up in terms of improvement, right? The veteran's been on medication, doing therapy steadily. Their PTSD scores, their anxiety scores are getting better, right? So that means there is some benefit to be had, right? So that is not a static condition, okay? So that's on a case by case. Now, there are certain diagnoses that are static. When I think about them, that's not a 100% rule, okay? But most of the time, schizophrenia is static, right? Schizophrenia is a psychiatric illness, but it's really a neurodegenerative illness, right? So it steadily gets worse over time. It usually doesn't go into remission. You usually need to be on medication all the time, and there's still some things that happen in between. Similarly, bipolar disorder. Bipolar disorder is another illness that tends to be around for the person's entire life. Okay, they tend to need to be on medication. Again, that's not a 100% rule. I've had some patients get better and go into remission without medication, but it's quite rare. Okay, so that's how you separate it based on diagnoses, and then that's how you separate it based on characteristics. It goes back to, are you getting better? Have you been on medications? Have you been on therapy? What's the trajectory of the illness? Pretty much.